Well, here we have Fauci, CDC mulling COVID test requirement for asymmetric. I'm grade 7, and here's another fear-mongering COVID talk by our great Dr. Fauci, who I have less and less, not respect, I take him less and less seriously each time he speaks. And I'll show one thing in the thing here where he actually contradicts himself here. But the article here, as the COVID-19 Omicron variant surges across the United States, top federal health officials are looking to add a negative test along with its 5-day isolation restrictions for asymmetric Americans who catch the coronavirus, the White House top medical advisor said Sunday. Dr. Anthony Fauci said the Centers for Disease Control and Prevention is now considering including the negative test as part of its guidance for after getting significant pushback on its updated recommendations last week. Under that December 27th guidance, isolation restrictions for people infected with COVID-19 were shortened from 10 days to 5 days if they no longer they are no longer feeling symptoms or running a fever. After that period, they are asked to spend the following 5 days wearing a mask when around others. The guidelines have since received criticism from many health professionals for not specifying a negative antigen test as a requirement for leaving isolation. Got to keep that fear-mongering going. There has been some concern about why we don't ask people at that 5-day period to get tested, Fauci said. Looking at it again, there may be an option in that. That testing could be part of that, and I think we're going to be hearing more about that in the next day or so from the CDC. Fauci, the nation's top infectious disease expert, I don't know about that anymore, said the U.S. has been seeing almost a vertical increase of new cases, now averaging 400 cases a day with hospitalizations up. Here's our cases, according to Microsoft Bing. There it is, United States. And we have seen an increase since middle of December. But it's kind of, past couple of days, kind of evened out a little bit. We may be at the top of the hump. He goes on. We are definitely in the middle of a very severe surge and uptick in cases, he said. The acceleration of cases that we've seen is really unprecedented, gone well beyond anything we've seen before. Got to shut everything down now. Fauci said he's concerned that the Omicron variant is overwhelming the healthcare system and causing a major disruption on other services. When I say major disruptions, you're certainly going to see stresses on the system, and the system being people with any kind of jobs, particularly with critical jobs to keep society functioning normally. We already know that there are reports from fire departments, from police departments in different cities that 10, 20, 25, and sometimes 30% of the people are ill. That's something we need to be concerned about because we need to make sure that we don't have an impact on society, that there is really a disruption. I hope that doesn't happen. Well, gee, maybe if you hadn't done your stupid mandate and fired a bunch of people, we wouldn't be seeing this major stress. Serious. These people worked for an entire year or more without the vaccine and did okay with an even more deadly variant. Now, the Omicron, I'm sorry, it doesn't seem to be the data is showing it's not as deadly. But, hey, this paragraph right here is where he contradicts himself. He goes, while there is accumulating evidence that Omicron might lead to less severe illness, he cautioned that the data remains early. Keep that in mind. The data remains early. Fauci said he worries in particular about the tens of millions of unvaccinated Americans because a fair number of them are going to get severe disease. Based on what? The data remains early. Where's your proof that they're going to, if it's less severe, where are they going to get severe? You're contradicting yourself right there. Sorry, that's what it is. And of course, now here's the plug for the vaccines. He urged Americans who have not gotten vaccinated to get vaccinated and booster and do so, and mask up indoors to protect themselves and blunt the current surge of U.S. cases. The Food and Drug Administration said last week preliminary research indicates at-home rapid tests detect Omicron, but may have severely reduced sensitivity. The agency noted it's still studying how the tests perform with the variant, which was first detected in late November. Fauci said Americans should not get the impression that these tests are not valuable. I think the confusion is that the rapid antigen tests have never been as sensitive as the PCR test. They're very good when they're given sequentially. So if you do them maybe like 2 or 3 times over a few day period, at the end of the day, they're as good as the PCR. But as a single test, they're not as sensitive. And it goes blah, blah, blah about sensitivity and all that other type stuff. I mean, to me, this is him and the media pushing the fear-mongering, especially this sentence, this area right here. Now they are pushing the fear-mongering more and more and more. And quite honestly, people are getting sick of it. You know, they're not seeing what they're pushing. And I'm going to go back on over here and just show what I mean by this. Now, South Africa was the big one. If you notice, they had a surge right here, went down, and this is really when Omicron came on out. They came up, down, and if you notice, deaths are not. Right there's that surge, and you don't see it right here. Now, let me know what you think. Is it as bad? Are we fear-mongering? Let me know. Leave a like, comment, and I'll see you next video.